It is the winter season and the flu is coming, or it is actually in here. So I think it's only fitting in today's session to talk about the flu. I'm a fourth year nursing student. I'm pretty much a nurse now. And one of my duties is to actually give a continuous education about flu, about all the diseases, how we can protect ourselves in a very good manner. And this is what I'm doing here today. Now, the first thing that I think is extremely important when it comes to the flu is that the mental factor. So a lot of big aspects about the flu is people's fear of it. People are afraid of having a flu, having a cold, or just not being in a very good, healthy situation, whether that be in there for college, for profession, for taking care of the kids, for taking care of the family, etc., or doing the job and being there. But that is a very big factor. I would say in the medical field, one thing that I have learned myself, and we all have learned as health professionals, is that about 60-70% of the cases we have is all mental. Of course, there are some situations that are physical and you can see it, but research have shown time and time again that a big chunk of what happens in the world and the diseases that people have are all in the brain. So, meaning it's called hypochondria, which means a disease in the mind, is that you believe that there is a disease when there isn't, right? And the cold is one of those things. I wouldn't say that you have a flu and you don't have it, but it's more, it helps you to attract it in the first place, as being afraid and being in a very bad mental position actually lowers your immune system. Lowering your immune system, meaning you're more susceptible to be overtaken by viruses in general. There's a lot of opportunist viruses like flu that can and find it easy, as you're already, we call it immune depression. So immunodepression, you're already depressed. Your immune system is depressed, is down, so it's easy for viruses to take over you. So that's a very first that I really want to clarify. And one of the moments that it really showed how important it is that I'm pretty sure in the 1930s or the 1920s, there was a research made by this doctor, and he found out that 75% of his patients or had this almost placebo effect. It's the hypochondria. They have disease, but it doesn't. There's another research that made, and I'm pretty sure with Harvard, is that 70% of people who say that they have a lower back pain is all psychological. It doesn't actually exist. And coming from my personal experience, I've seen some of this. I've seen a lot of fears. I've seen a lot of just fears of diseases that actually manifests. And I would say one of the most crystallized examples that a man can give is chronic diseases. Now, chronic diseases are different and varies. As an example, we have diabetes, we have cardiovascular system diseases, right? Like hypertension, high blood pressure. We have some other chronic diseases like cancer and asthma and everything. But I'm talking more here about diabetes and cardiovascular system diseases that are very, very, very common. There's a lot of people, big population that has it. And it's pretty much, I would say, if we eliminate cancer, it's pretty much the diseases of our time. But nevertheless, whenever I go to the health centers, when we actually take care of the patients of chronic diseases, one thing that I notice every single time is that a lot of patients are just obsessed with diseases. They're just obsessed with it. They're obsessed with diabetes. They're obsessed with high blood pressure, even if they don't have it. I've seen it even in one of my colleagues. I'd say, yes, it makes sense because we are nurses and, right, we talk a lot about this, but I've seen one of my colleagues coming to me and he said, I probably have a high blood pressure, chronic disease. I said, what are you talking about? You're 20. You're talking about high blood pressure, chronic disease. You shouldn't even be doing this. But he was trying to convince me in this and that, but just shouldn't be the case. As someone who's young, it shouldn't actually even, you shouldn't be even worrying about this, right? He's obviously healthy. He walks, he does a lot of things. And I look at him, he looks quite good. But it's one of those moments where really you see the fear taking over people, which is not very good. I wouldn't lie, it's not very good. Now, let me explain this more in detail right now. So when it comes to fears, there's a lot of types of fears. There's fears that are just because of one disease. I'm sorry if that touched the mic. There's fears that only touch, let's say, per se, one disease. And there's fears of ill health. There is different fears for different people. Now, when it comes to the flu, I'd say the number one basic fear is the obsession over you have to get cold or to get sick in the winter, which is not true. There's a winter that it can happen that you go through an entire winter where you don't get cold, when it's normal and you just don't get cold. And that should be actually the normal state of us as humans, is that in the winter, you are not supposed to get a cold every single time, every single winter. Because you're healthy, because you're taking care of yourself, because you're doing sports, because you're eating healthy, because you're taking care of your mental health, you're checking with your doctors, etc. Now, let me talk more practically, and this will be more of the practical side of it, as I think it's quite important to also understand the practicality and I'll say the details about it. So let me explain. When it comes to the flu, I'd say the number one thing is probably wash your hands. There's different types of washing your hands. The simple washing your hands is about 30-second rule. You wash it with soap, whatever you have in your house. You try to cover as much as possible. So you cover your fingers, the back of your fingers, between your fingers, right? Your nails, right? In different ways, all your fingers, your wrists, etc. So this is like covering the entirety of your hand, which is a simple hand washing. There's obviously some other advanced things. If you are chirurgical, there's chirurgical hand washing, which is in the operation rooms. And that is more advanced, where obviously the water cannot touch you, and it's more of in the sterile environment, and I assume you're not in. But when it comes to life day examples, you want to wash your hands at least when you come back from work, you come back from whatever you work. Pretty much every work environment has some sort of sources of contamination. So you really want to, when you come back, you wash your hands. So at least you reset yourself. And obviously, you have to wash your hands after touching something is a bit dirty, or maybe after the toilet, etc. So you be careful. When it comes to the flu, really, we're not talking about food directly, as right, obviously you should wash your hands before food. But when it comes to the flu, it's not really about the food, but it's really about maybe you have something in your hand, you touch your nose, whatever, you inhale it. Now there is some other things, which is, as an example, you see someone who has a flu or has the symptoms, maybe just one sign or two, you stay away, or you give him a mask, or you take a mask, or whatever, right? Or preferably you give him a mask, because the masks, one thing about the masks that people don't know is that it doesn't protect you, it protects other people. We're talking about the normal mask. There is the V95 that actually protect you, but they're quite rare, and they're more rare and more expensive. and it's not the normal mask that you always find. The normal mask, the blue mask that everybody wears, are actually more protective of you, more protective of other people than you. So when you cough, when you whatever, those, you know, those gotlets, which is like small drops of saliva that goes out of your mouth, doesn't actually go and infect other people, which is the main source of contamination when it comes to the flu, the respiratory system, or the respiratory system. So that's as a way of contamination. Now, this is quite important. I'd say there is also some other things when it comes to the flu. So once you start having the signs of flu, you should be careful. You should actually rest, right? Always make sure to let someone know, especially if it's something severe, or you haven't had, like, you've had some severe symptoms that you haven't had ever before. So that's important to let people know about you. And I would say if it's really severe, don't mind actually checking with the doctor. Generally, if it lasts long, you gotta go to the doctor. Or let's say you have a hyperthermia of 40 or more than 39, you should check with your doctors. Hypothermia, I'm not sure if you can have it with the flu, but if it's 35, 30, 34, you should check with the doctor as well. So those are like some norms that you should probably basically just keep them in your mind, if that makes sense. I'd say some other things that actually are important as well, which is actually giving yourself the health that you need, the rest that you need when you have a flu. So I'm going to give you an example, a concrete example by me. So I haven't had a proper flu, but I had some sort of a flu me as well before New Year's, this time actually. And it was pretty bad. So, right, and I am a nurse, I understand all the aspects, but nevertheless, it's still, if you get sick, you get sick. I was literally vomiting at 5 a.m. in my bed. I was vomiting like 3 liters out of my stomach, and it happens. And I understood why it happened, but also I made sure that I gave myself the rest. Well, unfortunately for me, I had an exam the next morning, but nevertheless, I really gave myself the rest before that and after that, beforehand and afterhand. So I make sure that I really do recover. I even stopped training for 44 days. 44 days, which sounds a bit extreme, but it's not. Because my body really craved that, really craved the rest and the recovery that it needed. So this is more of listening to your body, listening to what your body needs, right? More than looking for norms, looking for something that is outside of yourself. Sometimes our body actually tells us more of what we want to know or hear than anything we can ever learn or read online or read in books or talk with other people. Because your body is your best friend and your biggest monitor. Our systems, we have 12 systems in the body that are all coordinating to just make sure that we are living and surviving and thriving. And when there is something going wrong, the 12 system makes sure that you know that and that you recover, right? And just so interesting to see that. Now let me go through about the flu. Should you wear a mask or not? I would say you should or shouldn't, depending on